The bispecific antibodies have come very fast to the field of multiple myeloma. We had the first bispecific antibody approved about 1.5 years ago. And within 6 months of that first approval, we had 2 additional bispecific antibodies approved. There are 2 targets. There's the BCMA and there is the GPOC5D. They are both expressed on the surface of the myeloma cells. And they seem to be very consistent across tumor cells within a patient and also across patients. And also there is preclinical data. Our group, when I was at Sloan Kettering, showed when you knock out one of the targets, the other target is still there. These bispecifics bind to one of these targets and also to CD3, which is expressed on the surface of T cells. So these antibodies, they link the T cells to the myeloma cells by holding one arm on each of these 2 cells, the myeloma cell and the T cell. The field has now got this FDA approved for patients with 4 or more prior lines of therapy. What's going on in the field is to see how they can be used in earlier lines. There will be studies presented at EHA, there are presentations at ASCO, there will be presentations at ASH again later in 2024 on how these antibodies can be bundled with other drugs, having different partner drugs, going for earlier lines, going for 1 to 3 prior lines, many trials already ongoing in that space. And there are also trials using these bispecifics in the newly diagnosed setting. There is no doubt in my mind that these antibodies are going to change the field even more than we can probably imagine. I think this will for sure change the field. And the question I asked before, whether it's time to retire the old terminology of transplant eligible and transplant ineligible. If people don't agree with that in the current era with 3-drug PI IMiD steroid plus minus a CD38 targeted antibody, I think the bispecifics, they will change that because they are going to change all the options. And I think that we will see more and more patients benefiting from these drugs independent of their transplant status. And we have also the CAR T cells that we have already FDA approved, even for the first relapse. So everything is changing for the better in the field of myeloma.